Okay, the first question, Dr. Moss, is what is evidence-based practice?
From what my understanding is, evidence-based practice is utilizing the research to implement into the clinical setting, along with using experience and the patient's goals in order to best come up with a treatment program for that individual and that particular injury.
Okay, very good. How do you utilize evidence-based practice in the athletic training room?
In my opinion, evidence-based practice has been around ever since we started athletic training. I've been a certified athletic trainer since 1993. I think it's just been repackaged here recently to put more emphasis on actual research instead of using just anecdotal or whatever worked type of techniques. So with evidence-based practice, it's something that we've always done, but we are now making sure that we focus on quality data that will influence the treatment parameters to help a patient get better. So, from that standpoint, I think I use evidence-based practice on a daily basis, which doesn't necessarily mean that I look up something each time that I have a new injury come in, but from my experience and knowledge, and then if I am not receiving the results that I anticipate, then I turn to the research to help influence or enhance the treatment parameters.
Do you feel prepared to practice evidence-based techniques?
Absolutely. Like I said, it's something that I think we've done, ever since I've been in athletic training, but it's just been repackaged and more emphasis has been placed on it with that. So, if I recall back when we, were talking about using ice, using heat, there was a lot of research back then saying, okay, what would be better? What are you trying to accomplish? So on and so forth. But now they're putting more of an emphasis on it. And I think the National Athletic Trainers Association, along with the NATA Journal, does a good job with supporting research to put actual scientific teeth within what we do in our practice anyways.
Okay. How much experience do you have with evidence-based practice?
Like I said, it's something that I've been doing, pretty much my whole career, with more of the emphasis here in the past several years on actually utilizing the evidence-based practice. So, it's something that's done on a regular basis, and so it's just something that we do every day. So it's do I have experience with it? Yes. Do I consider myself an expert with evidence-based practice? I think I'm always learning, and I think that's something about the medical profession, is you always need to keep up with the newest techniques in order to best serve your patients.
Okay, and then lastly, Dr. Moss, could you tell me what do you feel are advantages of evidence-based practice, and then maybe some disadvantages that you can see with evidence-based practice?
Well, with evidence-based practice, it's like anything else in medicine. When you have an individual patient, they may not particularly respond normally to a proven treatment. So from that standpoint, that's where your experience and thinking outside the box sometimes will need to go into treatment of a patient. So that's one of the disadvantages. One of the advantages is that it gives you scientific proof that yes, it has worked with your treatment settings or with your treatment. So you always want to reflect on that first in order to try to maximize your outcomes. But if that doesn't work, you also need to treat the person as an individual. And when that happens, that's when you're doing your patient-centered care that really provides the best treatment for that patient.
Okay, very good. Thank you, Dr. Moss, for participating in this video for my assignment Journey to Oz.